Welcome to the Eat Away Kidney Stones podcast. I'm your host, registered dietitian and kidney stone expert, Melanie. After learning a ton about kidney stones and helping people prevent stones at the University of Chicago, I was fed up with all the terrible advice people were finding online. So I decided to do something about it. The Kidney Dietitian was born. This podcast is for people who want to learn what actually works to prevent kidney stones and still enjoy life, eating, and their favorite foods. Let's dive in. For today's episode, I am thrilled to welcome Dr. Megan Prochaska. She is a friend and previous colleague during my time at the University of Chicago. She is currently an assistant professor of medicine at the University of Chicago and, of course, a member of the kidney stone program there. She went to medical school and residency at the University of Chicago, and then she did her nephrology fellowship at the Brigham and Women's Hospital / Mass General Combined program. She stayed at Brigham and Women's Hospital for her research fellowship, where she also got an MPH at Harvard School of Public Health, and that is when she began doing research on kidney stones. She came back to the University of Chicago a few years ago to join the kidney stone program and to continue taking care of patients with kidney stones and other kidney-related diseases. And she also does a ton of research on kidney stones with the mission of finding more strategies to prevent them. So with that, I am again thrilled to welcome Megan to the podcast. Hi, Megan. Welcome to the podcast. I am so excited to have you.
Thank you. Yes, I'm so excited to be here.
It's so good to see you again. And it's also exciting because you are the very first nephrologist that I have interviewed for the podcast. So you can forever hold that title.
I didn't know that. Yes, I'm honored.
Yes. So today, I know we want to talk a little bit about kidney stones and bariatric surgery. And I know that you have done a little bit of research in this area, right?
Yes. So we do know that there's certain types of bariatric surgery that increase the risk of kidney stones. Those are more primarily the type of bariatric surgeries that we use the term malabsorptive in nature, but essentially it's more the Roux-en-Y gastric bypass or duodenal switches. Those are the ones where the surgeon will move around the intestines a little bit more so that it's not just that they make the stomach smaller, although they do make the stomach smaller in those surgeries, but they also move around the intestines so that the food that does go into the stomach is not as absorbed as much as it was before the individual had the surgery. So it has a restrictive component. That's the term we use for the smaller stomach, but also malabsorptive. So those people, like I said, don't absorb all of the nutrients out of their food.
Got it. So it sounds like the malabsorptive type surgeries are the ones that are most associated with stones. Is that correct?
Exactly. Yes. And so, and part of what happens there is that there's probably a couple of different things that contribute to the fact that the individuals who have had that surgery are at higher risk of kidney stones in the future. And probably, like I said, there's a couple of reasons why. One of the things could be that because they have that restrictive component, they drink a lot less water. And any of the people who are listening, if they've had those procedures, you can know that sometimes you're even counseled by the surgeons to drink less water, or at least don't drink water at the same time you eat food, because that water can fill you up quite quickly, and then they're not getting any of the nutrients that they need. So it can change the way people eat if they drink too much water. And so that contributes in some ways. And then there's a couple of other things that we see when we do a 24-hour urine collection, for example, some changes in the urine collection that we see afterwards that increases the risk of forming of stones. And one of those is that those patients tend to have higher urine oxalate levels. And because the surgery, the way it changes the way we absorb food, it also changes the way we absorb the oxalate out of that food. And that can cause us to have an individual who's had the surgery to have too high of oxalate levels in their urine. And that is a major driver of stone risk in those people. Mm-hmm. That being said, I keep saying stone risk. It doesn't mean that everyone who has bariatric surgery is particularly these types, the Roux-en-Y gastric bypass surgery. Doesn't mean they're all going to get kidney stones, but it just means that in all the studies, compared to other people who have not had surgery, they're at higher risk.
Yeah. How much higher risk are they?
So usually, what's the point estimate on that right now? It's I don't remember exactly to give you a summary number. I'd have to pull up some of the I'd have to pull up a couple of papers to give you I want to be specific about it. But
I think I remember. I remember seeing in the most malabsorptive procedures, it was around a 3 times greater risk of stones compared to the general public. Does that
Yeah,
sound
that
about
seems
right?
probably about right. Yeah.
Yeah, yeah. Okay, so we know that these very malabsorptive bariatric surgeries are putting people at higher risk of stones. So for anyone out there who is listening that has had these types of surgeries or is maybe considering having one of these surgeries, what do you think that they should do, or what should they know about what they could do to reduce that risk of stones?
Yeah, I think that one thing that we can all do is just make sure that I don't, even though we know they're at risk for having low urine volume because they don't drink as much, and at risk for having high urine oxalate because of this concern about the way their body absorbs oxalate. Um, I think that all of those individuals should just keep in mind that even though they may be at higher risk, it's really important for them to continue to get a well-balanced, very, very diet and keeping up their hydration status. So I don't necessarily, for those people, want them to make major changes to their diet that they're not already making to make in terms of, I want them to be making good, healthy choices in general and staying well hydrated as much as possible. But I don't want them to, there's enough restrictions that we tend to put on people as they're trying to be on a healthy weight maintenance diet. I don't want to necessarily add a lot of additional worry to that, because I think that most of those people, as long as they're having a healthy, varied diet, it's going to be good for their overall health, and probably also going to help to maintain their stones as well, or their stone risk as well. I think that that probably the one thing that they have the biggest control over is just making sure that they stay well hydrated, and not limit their water too much. That's
Yeah.
probably the one thing that they can do.
It
And
always
yeah.
comes down to water. It's
I
not
know.
exciting, but
Well, it's
I
also one of
almost
the things
like,
they can do. And they know it's like also sort of measurable, right? So the one reason why I hesitate a little bit with the oxalate is some people, if they were to form a clinic and form a stone and I'd see them in clinic, I might do a 24-hour urine collection and actually quantify that oxalate that we just talked about. And for some of those individuals, we might need to talk a little bit more specifically about restricting their oxalate. But if an individual has not formed a stone yet, even if they're at higher risk for that, I don't necessarily want to put that stress and that worry about oxalate on their plate, literally or figuratively, as they're already trying to make sure that they're eating a healthy diet, which of course is what we all want to do. It's what I'm trying to do, and we're all trying to eat healthy, and I want them to be able to do that too.
yeah, absolutely. And there are so many different nutrition considerations for people after bariatric surgery that are really important. Um, and I am just thinking that a lot of them they seem very different than what the sort of generic recommendations are for stone formation, right? So the one thing that I'm thinking of is protein. So people who have had bariatric surgery are often told to eat a lot of protein, and they need a lot of protein to help maintain that muscle mass through that very quick weight loss, and also right after surgery to help their bodies repair themselves and heal. And so I wonder if you can talk to, it seems like the mechanism of kidney stone formation in bariatric surgery is very different than sort of your typical oxalate stone former. So can you kind of talk about how the nutrition might be different between your sort of run of the mill calcium oxalate stone and someone who has bariatric surgery?
Yeah. So, I mean, I think that there's in terms of the high protein aspect, I'll say that, I don't typically, because I know that the patients have a lot of other nutritional needs, I don't typically put them, I say it's okay to maintain their protein intake as they are, because they have to meet those nutritional needs. I think that we try then to target, when I do have a patient who has bariatric surgery who is forming a kidney stone, it's helpful to have that 24-hour urine data, because then for that individual, we try to target what's the main driver in that individual. And that's, I always try to describe to my patients, I know it's not the most fun test to do in the world, but it can really give me that helpful information for in that end, and in you, what's really your main driver. And if it's sort of a little bit of oxalate, and we can do a couple of specific strategies to try to bring down the oxalate, but it's maybe also you have changes with your acid-base balance. And so maybe there's something else we can do that, you and I haven't even talked about, which is starting a medication that can help adjust the acid-base balance that could also contribute. So with all of those things, that's how, with that, I tend to take it on an individual basis. And that's where the 24-hour urine collection can be really helpful for me to sort of target an individual's specific needs. Because for everyone, a calcium oxalate stone, that's the most common type of stone. And some people, everyone forms it for a slightly different reason. And that's also true amongst our patients who have had bariatric surgery. And once they've done that, that's when we can use the 24-hour urine as helpful data to help guide us to try to say, okay, which bucket are you in? Are you in the type of person who is purely an oxalate issue? Okay, now we can really go into that, and we can talk about calcium intake and all the different strategies that we use for oxalate, or is it something different? And so hopefully that gets a little bit at the answer to your question.
Yeah, absolutely. I think what ultimately you're saying is that it's really different for every single person, even people who have had bariatric surgery, right? It's not, if you've had bariatric surgery, it doesn't mean that it's necessarily an oxalate issue, or that oxalate is really the biggest driver. It could be pH is off, your citrate is off, something like that. Is that
Exactly.
what I'm hearing?
Exactly.
Yeah, absolutely. Yeah. And that's a message that I've worked so hard to get out.
Oh, good.
That everyone needs a 24-hour urine test. If people have been following me for 1 hour, they likely know that I am a big advocate.
I'm sure you've said it, but this is exactly why. Yeah. Exactly.
Yeah. I will say that, and you know this, that a very small percentage of people who have had stones, bariatric surgery or not, have had that urine test. I think the most recent estimate I've seen is around 20%. Is that what you've seen?
Low. Yeah, that seems probably about right.
So what would your advice be to people who haven't had that test, whose urologist hasn't brought up that test? What would you recommend that they do?
Yeah. So I think that just one thing you can just do is speak up to your urologist. If you have a urologist you follow with, just say, hey, I've been learning more about kidney stones. I heard that there's a 24-hour urine test that's really helpful. One of the reasons why your urologist might not have brought it up to you is because he or she may not be incredibly comfortable interpreting them, because the company that's most common, it's a national laboratory called Litholink, and probably, you may have heard, Melanie, I'm sure you've talked about Litholink before, but it's a very common company that's used. It's what we use for our patients. And but when you get a Litholink report, it comes with 3 sets of rows of a lot of data. And to someone who's not used to interpreting that can be a bit overwhelming and can seem like a lot. Once you break it down and learn about it, it's not so much. And Melanie and I, of course, know how to do that. But it could be that your urologist or your provider is just less familiar with that. And so I think that just starting that conversation though with the urologist, and it could be that maybe there's a nephrologist who they could refer you to, who's a little bit more comfortable with it, who could just take 30 minutes and sit down and go through your numbers with you. So think about that strategy as well. It doesn't mean you're not going to be able to still have a good relationship with your urologist, or maybe your urologist can start learning from Melanie and all the different things that Melanie and then be able to interpret it too. But that's one thing I would say is just I think getting started by just talking to your providers is always the first step in terms of how to get some of that information for you as an individual.
Absolutely. And in my experience of, encouraging all these people in the world to get 24-hour urine tests, 9 times out of 10, doctors are more than happy to order them. And correct me if I'm wrong, Megan, but Litholink tests even come with kind of some suggestions to help your doctor interpret all of those complicated numbers. Is that right?
Yeah, that's a huge point, actually. Thank you, Melanie. I forget about that. No offense to the people who I actually know who wrote all of that interpretation data for us, because I don't use it just because I don't need to use the automatic report. But there's been the experts at Litholink, which include nephrologists who are experts in kidney stone prevention, have, and Melanie, you've probably talked about this, but they have really extensive reports that are available for the patient to take a look at, but also the providers to take a look at. So if you do have a urologist that's less comfortable with it for whatever reason, they'd have some guidelines and some backup with the automatic report that gives some suggestions for interpretation and strategies in that setting. Not just like, okay, the urine oxalate's high, but also here are some strategies to consider to help bring it down into a range that we would that helps to keep lower risk a little bit lower.
Yeah, absolutely.
Yeah.
Do you know, Megan, for listeners who are not in the United States, do you know of what they might do? I get a lot of people from Canada and also Europe and truly all over the world.
Yeah.
What would your advice for them be?
Yeah, I mean, I think that so when it comes to 24-hour urines, any laboratory can really do it. Now, most labs are not going to do all of the things like the oxalate. We've been talking about oxalate, so I'll mention that one. That assay is challenging for a lot of labs to do. So it's not necessarily going to be available absolutely everywhere. I know that there are some nephrologists in Canada who have asked Lithlink to be available there, and I know that the folks at Lithlink are aware of that, but it hasn't for complicated reasons that are well above all of us. That's not the case yet, but but I do know that there's some excellent providers in Canada who I've been able to interact with, who I know are trying to build stone clinics there, and they've talked to the folks at Lithlink so that at least they can sort of do the same tests that are of all those different things that get measured and calculated and what the Lithlink lab report gives us as the result of the 24-hour urine. I know that there's some providers there who are trying to replicate that in more locally, and I can't comment on I just happen to know some people in Canada, so I know that's happening there, and ideally it's happening in other places as well. I just don't totally know, but it's always like how I said it earlier, it's always worth at least bringing it up with a provider because parts of it are at least probably possible and can give you some good data.
Yeah, it seems like at least like a urine calcium is pretty standard. Obviously,
Sure.
urine volume, that alone can be really helpful to know.
Yeah.
Are you meeting
that
that 2.5
we
liter?
can even measure just pee in a cup or pee in a jug for a while.
Right.
You can measure how much you made.
Yeah.
Exactly.
Yeah. I often tell people to keep their urine collection. If you do a 24-hour urine test, keep your jug. So then, and just rinse it out maybe, but then just keep it. And then you can just kind of spot check yourself on your urine volume to see if you're meeting the 2.5 liter output or whatever goal your doctor or dietitian gave you.
Right.
Yeah. All right. Well, great. Always love talking about 24-hour urine tests. Again, I know if you've been here, you're probably so sick of hearing me talk about those, but as Megan highlighted, they really are so, so important. Without it, we really are just kind of guessing as to what is forming your stones and really don't know how to target and come up with the most effective treatment plan for you. So yes, we'll move away from our segue and come back to bariatric surgery.
Yeah.
So, you mentioned that maybe your urologist could refer you to a nephrologist. What is the difference between a urologist and a nephrologist?
Yeah, thank you for making sure I clarified that. So we work really closely with urologists when it comes to kidney stones. And once a kidney stone has formed, and these are mostly when I'm talking about calcium stones, once calcium stones, and the majority of people who form stones form calcium stones, once those are formed, I can't dissolve it away as a nephrologist. There's nothing I can do to make it go smaller. But what I can do as a nephrologist is try to prevent new stone using the information from a 24-hour urine and then working with patients to target their stone, what's driving up their stone risk. We can use that to prevent new stones from forming and prevent any stones that are in there from getting bigger. And then when we really rely on our urology doctors so our urologists are surgeons, but what they can do is actually go in and retrieve those stones, or if the stones decide to move and cause problems and a lot of obviously severe pain, it's really our urology experts that we rely on to help us in terms of that acute management of passing stones or stones that need to be retrieved. And so we work together for more on the prevention side for nephrology, and then urology is the procedures when it comes to the stones, and then our dietitians usually are more on with us on the prevention side of it. They're not in the OR either.
No.
that group is, when we think of a comprehensive kidney stone group, it's going to be a nephrologist with a dietitian and our urologist. And there's probably other people who, of course, there's other people who part of it for those
PAs or nurses might be
exactly
helping.
all those people who are really important, like the MAs, PAs, and RNs that are really key. But those are sort of what the breakdown is in terms of kidney stones and kidney stone management.
Yeah. So would you say that everyone with kidney stones should be seeing a urologist, of course, to help manage the stone itself, but also a nephrologist for prevention?
Yes, of course I'm biased because I'm a nephrologist who specializes in kidney stone prevention. But yeah, definitely. I think that, I talk to our urologist quite a bit about who's really, and our primary care doctors, who's really important in terms of, who are the people who most need to see nephrologists. And as I just said, on the nephrology part of it, we really focus on prevention. So the people who are really key are to be seen by us are the people who are more likely to have another stone, and the people who are more likely to recur and have another stone are going to be people who have already had two stones. So if you come in, and even if you're hearing about kidney stones for the first time, but you happen to have two stones in there, unfortunately, we call that recurring because it's more than one at a time, and that would be definitely someone who I'd want to come see nephrology. And so it's people who have had multiple stones, or the people who we think are at higher risk. So the people who have had bariatric surgery, we do think it'd be, even if you've only had one stone, we'd probably want to see you at least once. Or if you've had a positive family history. So if, even if you haven't had a bariatric surgery before, if you and your brother have had stones, you're probably at higher risk for having a kidney stone. And so that'd be someone who we would encourage you to see a nephrologist, unless your urologist does a lot of prevention, but mostly the vast majority of them don't. So the assumption would be that they don't do a lot of prevention. And so so we would encourage you to sort of mention to them that maybe seeing a nephrologist would be helpful for stone prevention.
Yeah. So it sounds like if you've had more than one stone, or maybe are just really interested in prevention,
Sure.
there's certainly no reason that you can't see a nephrologist.
Absolutely. Yes. I'm always happy. Even if someone's only had one stone, and I don't necessarily think they have other additional risk factors like family history or their own medical history that I think puts them at risk. If you just want to make sure you're doing everything you can to prevent stone number two, because stone number one was quite painful, then absolutely we're happy to see you and talk about prevention and nephrology as well for that.
Yeah. What about, would you say that everyone who has had bariatric surgery, especially those very significant ones, the big malabsorptive ones, would you say that they should go see a nephrologist or no?
Yeah, I think that probably, I think they probably don't, every single one of them probably does not need to see a nephrologist. Certainly once, if they've had after one stone though, I would want them to see it. But if they haven't formed any stones yet, it's probably okay for them to not see a nephrologist and instead focus on just making sure they're maintaining their fluid status, like by drinking a lot, not getting dehydrated, and then focusing on that good, varied, balanced diet that they need to be on for healthy. I think that that's probably good from a stone and other prevention standpoint. And once they form that first stone though, of course, then we'd want to see them.
Yeah. Yeah. Not saying that everyone is going to form stones. We already said that, but just wanted to kind of highlight that.
Which is why I'm saying we don't all need to see us, because not every single person who has bariatric surgery is going to have a stone, and they just are at a higher risk compared to someone who has not.
Yeah, absolutely. And just to again highlight what you just said, I think that for everyone who has had bariatric surgery, especially once you're kind of recovered and you're kind of back to your new normal life, really the most important thing you can do to prevent stones is drink enough water. And that is the one thing that holds true for every single person with kidney stones.
Yes.
Unless you have heart failure.
Calcium based or others, they all can benefit from that.
Yes, absolutely. Struvite, cysteine, even those really rare ones. So drinking plenty of water. And for a dietitian tip for someone with bariatric surgery and you want to get enough water is because your stomach may be smaller, is just kind of taking small sips. You're likely not going to be able to down 16 ounces of water every 2 hours like someone who hasn't had bariatric surgery might be able to do. So really just taking small sips, kind of constantly having your water with you at all times can be really, really helpful.
That's my joke test to my patients. Like if they, while we're talking, sometimes they'll just like, as you talk about getting thirsty, they'll grab their water and I'm like, you passed the test. You have water with you in your bag. Perfect.
And you brought water with you.
Exactly. Yeah.
You always have it.
Yeah.
Yeah. It's so important. Again, it's not exciting. I probably don't talk about it enough just because it's not only the one thing that holds true for everyone, it's probably the most effective thing you can do. We get fancy with sodium and calcium and oxalate and protein. Like, we talk endlessly about all these things, but really water is probably the most important thing that you can do to prevent stones. Yeah. One last point I wanted to ask Megan about bariatric surgery was calcium supplements. So I take, as a general rule, I take a pretty strong stance against calcium supplements because we've seen in some studies that they increase the risk of calcium-based stones. But I do think that maybe there's sometimes calcium supplements can be a good option. And I think that bariatric surgery might be one of those times. So I know that a lot of my listeners are afraid of calcium supplements, but maybe we can talk a little bit more about that.
Yeah. And so this is like, yes, this is the one space also where I would say that calcium supplements are probably okay. Typically, what I'm going to first do is, starting with the 24-hour urine calcium, because the concern with the calcium supplements is that they can, if particularly depending on the timing of when they're taken, if they're not taken with food, we do tend to see that they probably lead to a higher urine calcium, and that can increase the risk. But the first thing I often will have my bariatric surgery patients do is time those supplements with their meals. And so that's, if possible, again, we know that can be challenging. And then typically, if you have a restricted stomach size, what's a meal? Because people tend to then eat many small things throughout the day. But if it can sort of be timed a little bit more with meals so that it can help balance a little bit of the oxalate and yet get patients the the amount of calcium that they need to reach their calcium goals for intake. That's usually what I try to do. And again, not to keep going back to the 24-hour urine, but then as we work on timing and quantity of calcium supplements to make sure that people are getting in enough calcium, because I do want to make sure they're getting in enough calcium for their bone health. Then I use the 24-hour urine to kind of guide me of like how are we meeting those targets where we're not driving up the urine calcium, but we're keeping urine oxalate not too high and making sure we're getting enough calcium intake for bone health. Yeah. So does that sort of answer? It's kind of a little bit hand wavy because it's not specifics, but that's sort of how I think about it.
Yeah, that's my thought process too. And yeah, I mean, it's hard to answer because it's going to be different for every single person. If those calcium supplements do, even when you take them with food, cause someone's urine calcium to spike, I imagine and be like, oh, we should probably stop that and really, really try to get calcium from food, because I'm sure both of us would always prefer to get calcium from food. Yeah. But realistically, that can be hard sometimes. Yeah. And for patients with bariatric surgery, I think calcium supplements are often a much more viable option than people who form calcium stones for other reasons.
Yeah, exactly.
Yeah, absolutely. So what tips do you have, Megan, for finding a nephrologist that really specializes in kidney stones? Because not all nephrologists are kidney stone experts, correct? So how can you know if the nephrologist that you're seeing is well-versed in kidney stones, or, where could you find a kidney stone expert nephrologist?
Yeah, so there are, certainly, at U of C. So people in the Midwest, we are a center at the University of Chicago, and so we are one place where you can find us. And there certainly are nephrologists throughout the country, and there's some areas where there are centers. So like down in Texas at Mayo Clinic, there's some, folks in Boston, I, because I'm in the world, know of, the folks at Stanford, for example. There's definitely experts kind of spread throughout the country. I think in terms of how to figure out if your nephrologist is one, or at least has some comfort level with them, you can always, I know it still seems sort of silly, but just ask them. So, say, what do you know about kidney stone prevention? And you can talk to them a little bit about it and know that, if you do have them, encourage them to order a litholink for you, that they'll have that backup of the, as you just said, Melanie, or you said earlier, Melanie, that of the report that gives some strategies that a provider and even a patient can take a look at and understand. I think unfortunately there's not like a website that sort of lists all the kidney stone specialists,
but or a certification or anything.
Or certification, right? There's no certification to prove that I'm an expert. I guess I'm a self-proclaimed expert because I work at the University of Chicago and I've trained with the people. But I think that the internet can show you, it can teach you a lot of things about like where some of the experts are. So you can always like kind of look up at your local institution and see if they mention kidney stones as something that individual does. That's always one way. Of course, the internet is fraught with lots of inaccurate data. So, particularly with kidney stones, although maybe with the providers who see them, it's a little bit different, but certainly with the nutrition information on kidney stones is very wary, which is why I always direct my patients to trusted websites like Melanie's, for example. I don't know. I wish I had a more straightforward answer other than take a look at the list of, where you're seeing, and then maybe just asking around. But if anyone lives locally to to Chicago, we're of course always happy to see folks and happy to have people come to Hyde Park and we'll see them and you'll learn even more about litholinks and we'll go.
You'll never want to see litholink again.
Exactly, right. So I'm sorry, it's kind of a rambling, not straightforward answer, but it's probably because we maybe at Rock Society we should put together something where it makes it a little bit easier for patients to find us. But
yeah, that would be wonderful. And I could think about building something on my website, kind of a list of all of the kidney stone centers. That would be hugely helpful. And it was not a trick question, but I did want to ask and see what you had to say, because I oftentimes don't know how to
answer it. Yeah, I know. Like if I know, if an individual asks me and I know generally where they live, I can give, I know so-and-so, or I know of so-and-so, and I would recommend, but yeah, it's, they're definitely all nephrologists should, they know a little bit about it, but unfortunately, most nephrologists didn't train at an institution where they had where they saw a ton of kidney stone patients, for example. I will say that we're working, there are some things that we're going to try to do at U of C that are more, like continuing medical education courses for providers to try to help for some of the providers who didn't feel like they got a lot of during their training or in their practice, see a lot of kidney stone patients for prevention. We're going to open up our goal is to, in the next year or so, have a course where we can invite those providers to come and just spend a day or day and a half with us virtually and learn about stones to try to get that spread a little bit more, so that more people can be seen by providers who have a little bit more expertise or have learned a little bit more about stones and prevention.
That's so exciting. I learned about that initiative recently, and I'm excited that it's there. And I hope that I may be involved. It sounds like.
Yes, so. I expect that our leader in that mission has already tapped you on the shoulder. So
yes. Yeah. So I think that's wonderful. Because I was so excited to offer my dietitian kidney stone training, because there's nothing for dietitians either. Dietitians most often have no stone training. I certainly had none as part of my internship. So it'll be wonderful to also have a resource for nephrologists and other doctors, I assume, too.
Yeah, I think the goal is to open it up to any providers who would have the time and who are motivated to want to learn. And we've already had people. I was on another podcast and I had a bunch of nephrologists reach out to me and say, "Oh, how can I take some sort of continuing medical education course on stones?" And so I know that there's interest there. And so you're, if whoever's listening, their provider, may have been able to be exposed to some of this as well. And there are some stone sessions also at ASN, but really, I think a course would be really helpful for folks.
A more comprehensive,
exactly.
Lecture at a conference is good, but probably not going to give you everything that you need.
Exactly.
Yeah. So it sounds like for now, until we can teach the whole world about kidney stones, maybe looking at large academic medical centers, like all the
Yeah.
places that you mentioned, Stanford, Mayo, University of Chicago, that's probably a good place to start. And
Mhm.
remember that even if you're not very close to one, if you find one that's in your state or state that's close, a lot of us are doing telemedicine still. I
Yeah.
don't think that's going anywhere. So
Great.
maybe you have to travel there once, but maybe not. It's definitely worth reaching out to someone if you are in a more rural location, as long as it's in their state, because then it gets
Yeah.
dicey with
That's
like
unfortunately
licensing
with licensure.
registrations and
Yeah.
yeah.
Because yeah, we're if you're in the state of Illinois, even if you live downstate or someplace it's not easy to get up to Chicago or over to Chicago for, we are seeing folks virtually, and we're happy to
Mhm.
continue to do that.
Yeah. And I think a lot of other places are doing that too.
Yeah, I think so.
So, yeah, great. Well, thank you so much for being on the
Yeah,
podcast, Megan.
this
This
is so
was
much
so much
fun.
fun.
Yeah.
Do you have any sort of closing remarks or last things that you'd like to say share with the world for kidney
Yeah,
stones?
I think that my big takeaway is just to remember kidney stones are preventable, and we know this. We know we can reduce recurrence, reduce time to recurrence, and so don't get discouraged. And sometimes it can take a little patience and repeating 24-hour urines, but we can get there without restricting diet too much, because that's always the goal, is to make sure that we're really changing what needs to be changed in terms of stone risk, but still allowing people to one, make sure that they can get a healthy, well-balanced diet, but also making sure we're not putting too many restrictions on diet, because food's important for health, but also culture and all sorts of things. So kidney stones are preventable. That's probably my takeaway.
What a great closing statement. Well, thank you so much for your time, Megan. Hopefully we can have
Yeah.
you on the podcast again.
Yes, I love to. Thank you.
Thank you for listening to today's episode. For more help with kidney stones, check out my website, www.thekidneydietitian.org. For more personalized help from me, check out my online course, Kidney Stone Nutrition School. I can't wait to help you prevent stones and live your best life. Happy eating and have a wonderful day.